Today, we'll be discussing a drug called Pyrvinium Pamoate. It was first discovered in 1955 and originally used to treat intestinal parasitic infections such as pinworm. You might wonder how a drug used for treating parasites could be related to cancer. Well, as scientific research progressed, it was found that Pyrvinium Pamoate can affect certain key signaling pathways associated with cancer, especially the W-beta-catenin signaling pathway. This pathway is often overactivated in many cancers, such as colon, breast, and pancreatic cancers, where it promotes cancer cell growth and spread. Pyrvinium Pamoate has shown the ability to block this pathway, helping reduce the proliferation of cancer cells. Regarding its mechanism of action, Pyrvinium Pamoate differs from traditional chemotherapy drugs that directly kill cancer cells. Instead, it disrupts the energy supply of cancer cells. Specifically, it targets the mitochondrial respiratory chain in cancer cells, preventing them from getting the energy they need to survive, ultimately leading to their death. Pyrvinium Pamoate has shown particular effectiveness against cancer cells that thrive in low oxygen environments, hypoxia, which are often resistant to conventional treatments. This makes it a potential candidate for treating difficult-to-manage cancers. Now, looking at its clinical trial progress, while Pyrvinium Pamoate has demonstrated anti-cancer effects in animal models and in vitro studies, human clinical trials are still in their early stages. Researchers are investigating its potential when combined with other treatments, such as chemotherapy or immunotherapy, to enhance its effectiveness and overcome cancer cell resistance. In animal models for colon and pancreatic cancer, Pyrvinium Pamoate has shown significant tumor-suppressing abilities, and its effectiveness increases when used in combination with other drugs. As for dosage, it's important to consider both effective and toxic dose ranges. In animal studies, the effective dose of Pyrvinium Pamoate typically falls between 0.5 milligrams per kilogram to 1 milligram per kilogram, which has been effective in selectively killing cancer cells with minimal harm to normal cells. According to in vitro studies, its half-maximal inhibitory concentration, IC50 Ta, is around 10 nanometers to 100 nanometers, meaning it can exert cancer effects even at low concentrations. However, doses above 10 milligrams per kilogram can lead to toxic effects, particularly in the central nervous system, making careful dose management critical in potential clinical use. There are also some challenges to its clinical application, such as its poor solubility and low bioavailability in the body, which may limit its effectiveness. However, researchers are exploring nanotechnology and drug modification strategies to improve its stability and efficacy, potentially making it more effective in human treatment. Pyrvinium Pamoate exemplifies the concept of drug repurposing, where an existing drug finds a new application, this time as a potential cancer therapy. As clinical trials progress, more insights into its effectiveness for cancer treatment may emerge. For those interested in exploring this further, reviewing research on cancer cell metabolism and the W-beta-catenin signaling pathway could offer deeper insights.